is any of it mismanagement of finances?
Well, we believe at the National Health Action Party that there's some really important things to do, and something that the NHS Confederation never mentions is that we should get rid of the healthcare market. We've got this ridiculous purchaser provider split, which is part of the problem because it cut the tariff that's paid to foundation trusts by 3%. So no wonder why they're in debt. They're getting paid less for doing more. Now that purchaser provider split, this is where the GPs are buying care from hospitals competing against each other. Now the transaction costs of that market system are estimated to be £4 billion per year by Professor Callum Payton from the University of Keele, and we're also wasting £2 billion a year on PFI repayments. So yes, there is fat to cut in the NHS, but we're looking in completely the wrong places. We're cutting staff instead of actually looking at the areas which are completely non-productive. So, we at the National Health Action Party think there's plenty of things to do before we even increase the budget.
Phil McCarvill, let Phil McCarvill respond to what you've just said. Just his thoughts on that would be welcome.
I think there are two things we need to focus on. One is the immediate challenge of how do we deal with unprecedented demand and financial pressures, and the second thing, which our members are doing as well, which is actually working with local government and with social care and with charities and other bodies to actually transform care over the course of the next 5 years, so that we get ourselves out of a situation where we are basically on a 3-monthly basis revisiting every time these figures are published, that we're asking why is this happening. Actually, we have, over the course of this Parliament, we have 20 quarters in which we can transform care, and I think it's important we focus on both the here and now, so how do we deal with these pressures, and then the longer term, how do we transform care so more people get care closer to home rather than a reliance on other services.
And to bring it back to how we as users, as patients and potential patients use the NHS, I'm keen to just delve for a minute longer in that, Dr. Clive Pedell, because when you try, my experience is when you try to do that, when you try to be an equal participant in the NHS, people look horrified and regard you as some kind of attack monster when you're just being an adult person asking questions in the NHS. There seems to be a terrible defensiveness in the NHS.
Well, I mean, I think, there's a huge issue about patient education. I think that's really important because if we inform patients a lot more about their own health and how they can manage their own illnesses, that's extremely important. But, you can push that too far. Some of the most vulnerable in society, it's extremely difficult, to get those messages, out to them. People living in poverty who are most affected are least able to, to get those messages to them. So we do have to, invest, to prevent a lot of the problems, and that's what we call the social determinants of health, and we're just not focusing on those, and we need to be focusing on prevention, but the government's cut the public health budget by £200 million. So actually, instead of preventative medicine being funded, it's being cut back, so it's not even being ring-fenced, so the government's going in completely the wrong direction.
Okay, thank you very much to both of you. Dr. Clive Pedell, co-leader of the National Health Action Party and an oncologist as well, and thanks to Phil McCarvill, Deputy Director of Policy at the NHS Confederation, which represents a number of health and social care bodies.